As always, when consulting a practice, I always look at the dashboard or pull a report to see how many patients in the practices are getting a fluoride treatment. Most practices have a pretty low percentage. In my entire career, I found one office that was getting 95% case acceptance on fluoride treatments. They were so passionate about the benefits of fluoride, they thought everyone should have it. When I asked them what their secret was to getting so many people to accept it, they just shrugged and said, "We're just that good." I then asked how much they were charging, and they said, "Well, we give it away for free." Of course that's their secret. I think that is an awesome paradigm, but it can also be a good source of production in the hygiene department as well. I have traveled across the country to help increase case acceptance in fluoride treatments. I often get the same complaints. "Oh, our patients won't do it. It's not covered by insurance. Patients won't pay, and they think it will cause cancer." All are real patient concerns. So let's address each one, because we want to make sure our patients are making educated buying decisions that are in their best interest. Step 1, make your recommendation for an at-home or in-office fluoride treatment personal. This would be saying something like, based on your risk assessment for getting cavities, you are at high risk. Your medications might cause dry mouth, or your Diet Coke habit is very acidic. Or after looking at your mouth, I see these little white bleached out areas that are what we call hypocalcification. Those areas are much more susceptible to cavities. Or a patient might have exposed root surfaces. In that case, I would say something like, a fluoride treatment would be a huge benefit to you because that area is not protected by enamel. So make your recommendation based on personal needs of the patient. Step 2, explain the benefits of fluoride. There are lots of them. Use phrases like new research shows or we now know. These are two phrases that allow you to present any new information to your patients at any time whenever you learn something new. It's a great way to introduce change. Benefits to fluoride include up to 75% reduction in new cavities. Make sure the patient knows it's not 100%, but 75% is significant. Fluoride also helps reduce sensitivity, helps prevent decay around the gum line, prolongs the life of crowns and fillings, and it tastes so much better. No foamy, gunky jelly trays. Fluoride varnish benefits all teeth for up to 3 months, much longer than the gels and the foams. That it's affordable. For example, it might only be $40. Compare that to the smallest filling we do on one spot, on one tooth, is easily over $100. Step 3, know your data and use the words feel, felt, and found. I would say something to the patient like, "I know how you feel." Others have felt that way, but what we found is fluorine, from which fluoride is derived, is the 13th most abundant element that is released naturally into the air and water. Also, fluoridation of community water has been credited with reducing tooth decay by 50% since World War II. Also, there have been states that have reduced the fluoride in their water to the proper 0.7 milligrams per liter of water to save taxpayers money, not because it was harming anyone. The National Cancer Institute itself has said this, and you can find it on their website. Fluoride in water helps to prevent and can reverse tooth decay. And I quote from the study, "Many studies in both humans and animals have shown no association between fluoridated water and cancer risk." In 1990, a study by the National Toxicology Program, part of the National Institute of Environmental Health and Sciences, did show an increased number of osteocarcomas or bone tumors in male rats given water very high in fluoride for 2 years consistently. However, other studies in human and animals have not shown any association between fluoridated water and cancer, end quote. The Public Health Service has said this. In a February 1991 Public Health Service report, the agency said it found no evidence of an association between fluoride and cancer in humans. The report, based on a review of more than 50 human epidemiological population studies produced over 40 years, concluded that optimal fluoridation of drinking water does not pose a detectable cancer risk to human, as evidenced by extensive human epidemiological data reported to date. Remember, systemic fluoride helps children's teeth develop to become healthier and harder. Once those teeth are formed, systemic fluoride doesn't help, but topical fluoride does, always, no matter how old we are. So present it to everyone. It's a benefit to everyone. So I challenge you to set a goal to get 80% of your patients to get a fluoride treatment. If just 80% of those patients get one, let's do some math. 6 patients a day times $40 equals $240 in additional production per day. Times that by 16 days per month, and you get $3,840 additional production dollars per month. Times that by 12 months a year, and that equals out to $46,000 a year in extra hygiene production for a wonderful service you can provide. It is a great benefit and service that is a win for the patient, a win for the provider, and a win for the practice. That's it, guys. If you have any questions, shoot me an email.